Welcome to the Simply Mindful Wellness Podcast. Join your host, Tracy, the Mindful Wellness Coach, as she takes a deeper look into nourishing your body, mind, and soul. Because being well creates the freedom to live life the way you want.
Hello and welcome to another episode of the Simply Mindful Wellness Podcast. I'm your host, Tracy Richardson, the Mindful Wellness Coach and Holistic Health Practitioner and owner of Hybrid Therapy. Welcome to the listeners, and today I'm joined by Heather Flexer from Better Wounds, all the way over in the United States, and we'll be talking about wounds and wellness. So welcome, Heather. How are you today?
Great. Thanks for having me.
You're so welcome. Thank you for coming on. And I'm really interested in this topic to discuss today because it's one that doesn't come up very often on a podcast, I'm sure. And it's absolutely fascinating. So would you just like to share with the listeners who you are, what you do, and why you do it?
Sure. I am a doctor of physical therapy for 20 years plus maybe now. And also a certified wound specialist, which is not always that common. You don't see that as much anymore. It's a little bit more doctor and nurse practice, but it's absolutely part of the scope of practice for physical therapy. And people are always like, what are you talking about? But it was always something that I gravitated towards and loved. And it's really cool when you can really help someone and they can see it healing, and you can, it's just one of those, we all find our little niche, and it was just one of mine.
Absolutely. So wound care is definitely one of the things that we all need to know about. It's certainly something that people who've been in and had surgery or have had an incident need to be aware of, and I feel a lot more education is needed around this area to get it out there to people. So in the UK, wound care is not necessarily something that's discussed in great detail. You might get a little leaflet to take home with you after having a procedure, and then you may get to see a nurse. You may not. And that is it. That's the situation. You might get a post-op appointment after that to remove sutures or staples or something like that. But it's not really telling you how to care for yourself. So what I'm hoping is today we can get some little pearls of wisdom about your best tips, how you can care for stuff, and some of the things that you kind of come up across within your practice. So it's really common to kind of come up against this in the physical therapy world. So even more like when you've got scarring and so on after people haven't been able to care for the wounds and so on. So if you could just tell us a little bit about maybe some of the wound types or what you come across in your practice.
Yeah, a lot of the folks that I talk to, it's after like an elective procedure. So it's either, a hip and knee or plastic surgery clients as well. Really don't seem to get much of the follow-up at all. Wow. So of course we're hoping surgery goes well. They're stitching you closed. You're going to stay closed. And that is, if your incision is dry and intact and closed, you should leave it that way. I see a lot of people trying to get into scar care and creams and the silicone strips and things like that a little too early. So you need to leave your incision dry, clean, and closed. It's going to help prevent infection. It's going to prevent it from opening up those sutures. And let that skin do what it's supposed to do and heal. So for the first 2 weeks, you're just going to kind of leave it alone. Leave it be. Your goal is to stay hydrated, get lots of protein, start trying to move around a little bit, get some fresh air, start taking care of yourself again. All that stuff is super important. Getting your mind right. Everybody has some stress and anxiety after a procedure, or oh my God, why'd I do this? So you really gotta just work on the mental fortitude quite a bit as well. And somewhere around 2 weeks to a month may be where you start to see issues, if there were going to be any issues. So like the infections may pop up around that time because maybe you're off, the antibiotics have stopped, like you finished whatever prophylactic course of antibiotics they've given you, or the bacteria has had enough time to kind of grow and make friends. So around like 3-4 weeks, somewhere around there, it might be where like you start to have issues. So it's just something to be aware of.
So what sort of things would you say that to look out for? Would you notice if there was something a little bit untoward?
So signs and symptoms of infection are going to be like redness around the area. So right around the incision is fine, but once you start going like a couple centimeters to an inch outside, if it starts getting bigger and growing, and even following the blood flow like up towards the heart, those are all like red flag signs. Pain, swelling, ooziness, or that incision opens up, no good. Time to go to urgent care or whatever, your primary, whoever. You've got to get to someone as sooner the better. It's not like a wait and see kind of situation. So it's better to get medically taken care of. And if you have anything like circulation issues that you know of, diabetes, heart disease, those kind of things where you don't have fantastic circulation, oral antibiotics are going to have a harder time getting to the spot. So, or if you've had multiple procedures where, it's the same thing over and over again, like the oral pill of antibiotic probably isn't going to cut it. So we're going to need, to treat it topically or maybe IV as well. So you're looking out for the red flag signs of redness, pain, swelling, oozy, drainage, odor, and even just generalized not feeling right, like feeling flu-like, achy, you don't want to get out of bed. Those are all like something's not right and you should seek medical care.
For sure. So a lot of people just think that when you have like a scar or something, once the skin's fine, that everything is okay with the wound. Is that always the case?
No. So the wound might be fine. If once your skin is closed, it may be totally fine, but the skin never really fully reaches the strength of the surrounding skin around it. It's always like slightly weaker. You're always like a little bit more susceptible to reopening in that area. And then forget it, you got scar tissue. So scar tissue continues to grow and change throughout your lifetime. So it may not, the issues with your scar may not crop up right away. It could be down the line. And I just worked with a woman yesterday, actually, whose surgeries, multiple procedures like 4 years ago, and she's back and healthy and out there doing stuff, but she's complaining in the area is like not feeling well when she's doing her activity. And I'm like, it's your scar, babe. Like we need to work on, you haven't been working your scar. Like you're not doing aggressive massage on it. And a lot of people are they don't like the way it looks. It feels different. They avoid it. Like, I don't even pay attention to it anymore. Like it's healed, I'm good. But it's still there. And even if you aren't comfortable touching it, like actually touching it, you can use like a brush or a tool. You can put something between your hand and your skin and just moving your skin, and it's supposed to move. And when you like try to move it, if it's not moving, there's a restriction, and those restrictions just continue to grow. I mean, you and I are in the same business. Like we know, like if you're all connected, everything's connected. So one pain in one spot can be coming from somewhere else, and really just depends on like how much damage there is.
For sure. And I think although surgeons, their job is done once they've stitched you up, once they've stitched you up, it doesn't really matter how they've stitched you up. Yeah, and you're probably not going to be in touch with those people.
Right.
Yeah, for sure. So we have like our elective surgeries in the UK as well, so the orthopedic style. One thing that does interest me is when you mentioned about like cosmetic surgery scars, because that's something that a lot of people don't even consider. So tell us a little bit more about that and the things that you encounter.
Well, so some folks will go to other countries because the procedure may be more cost effective, like they're getting a better price going somewhere else, or maybe they don't have the BMI requirements or health requirements. They just kind of like, if you're going to sign up and pay, I guess they'll take you. So once you get home, right, I said around that month, like you may start to have some issues if large portions of skin were removed. Healing can really, like a tummy tuck or body lift or something like that, after gastric bypass, the skin may not recover well, and that may just be because a lot of tissue was removed. It may be because that your health to begin with wasn't fantastic, or they did so many procedures at once that it was just so traumatic. And now, I mean, I don't know how you get on a plane after I don't like getting on a plane in the first place, sitting in one position for a long time. I can't imagine right after surgery. So that's one of the issues that I see, is that once you get back to your home country, then the doctors don't want to touch you because they don't know
What's
what
going
happened
on,
unless it's an emergency, and of course they're gonna treat you for whatever, but they may not like fix whatever the issue is. So that's an issue. So some folks will also go for aftercare with people that may or may not be really qualified to be working on them and understanding all the goes into medical care. So that's an issue as well. Infection can be a big issue with that. Incisions opening up. And you mentioned how like some folks will go to their doctor to have sutures or staples or whatever removed. That's also like a weird situation where sometimes they're telling you to kind of do it yourself. Or people pop stitches or spit stitches, where a lot of times they're using disposables or not disposable, like it degrades on its own, but it doesn't always work. Not everybody's body works the same. So sometimes the body will like literally spit the stitch out. And you can usually tell because it'll be like along the line and it's like poop, 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 poop. Like it's just perfectly positioned, and you can tell like that's probably how someone, where the stitch like knots are that they just kind of spit out. And usually it's pretty easy. Once those come out, the wound, the body wants to heal. So your job as a patient is really to make the best environment to let your body do what it wants to do. It wants to heal. So like feeding it, watering it, walking it. Yeah.
You mentioned about like kind of referred pains and things like that. And obviously we know that everything is connected. So after some cosmetic procedures, people are not really, I would say, informed about like it is a huge kind of procedure as they would be if you have like a knee surgery or a hip surgery or things like that. Particularly I find around the eyes, around this area here, not issues with the stitches or anything like that, but sensitivities afterwards. And liposuction, scarring from liposuction. People don't anticipate that that's ever going to be a thing, but sometimes it is.
Yeah, like you're just looking at the end result, right? Like, oh, I'm going to be all snatched and everything's going to be right where I want it. And you're all excited about like the end goal, but any surgery healing can take like 12 weeks plus to get to where you want to be. there's, I think, the fine balance between aftercare as well. Like you see some that get no aftercare and they have lots of issues with restrictions and scarring, but then you see people that do like a lot of aftercare, maybe a little too early, and then they develop issues as well. So you really have to like listen to your gut a little bit too. And sometimes I find myself in that position with people being like, well, if you don't feel up to getting that massage, or you don't feel up to getting, like, it's okay to postpone it. Like if your body's like, I really can't do it today, like it's okay. But then there's the people on the other spectrum who, like, let's say after a mommy makeover, right, like a tummy tuck, maybe the boobs are done. Usually they tie in some lipo with that as well. Like you're going to be hunched over and getting just to standing up straight and moving is a feat in and of itself. So there's lots of room for improvement, and there's so much you can do. It's got to be overwhelming to be.
Oh, for sure. And overwhelming for the body itself as well. It's a huge procedure. So how did you get in to working with wounds, and like, how did you find your niche?
Yeah, I knew I liked it right away from college. I did some internships in wound care. That was more traditional as far as like actually in a wound clinic, and that was more like diabetic ulcers or like lower extremity venous insufficiency, lymphedema, like those kinds of things. And then I spent some time in sales and management and dressings and working in long-term care facilities. And that's way more pressure injuries just because people aren't as mobile, and skin can fail and break down and all of that. And then for the last couple of years, I've been working, just kind of found this community of folks that needed help. And it's more in plastic surgery land because they really don't have the resources or it's just not, there's not a lot of research either is what I'm finding. There's not, there's the information that's out there in wound care tends to be more about chronic issues like diabetes, vascular, pressure injury, and all the stuff is skewed that way. And maybe a little bit because of money, like that's the big, where the big players are. But there's this whole other community of folks that are, able-bodied out there walking around, but they've had a procedure, and then there's very little information, and it's all coming from, other people within the community. So I often find that people are using like a mishmash of products, and they've kind of cherry picked some information, and some of it makes sense and some of it doesn't. So I do a lot of online consults for people that are trying to manage their wound kind of on their own at home. Like they maybe have, like, their doctor has prescribed medication or, whatever, but they don't really have a wound care specialist to work with. Because what I usually find is like just a few things are off. Like they're using the wrong cleanser, or they're trying to put a wet dressing with a dry dressing, and then they're leaving it open to air, and that, like, it's just it's not quite mashing up. So I just help them come up with a plan and kind of work with them through the process of healing. And usually we're good. Sometimes it's even just helping them be like, no, you're good, girl. Like,
absolutely,
it's fine. Yeah,
absolutely. So what do you love most about working with wounds?
That I can help is always great. That it always makes you feel good when you are like, oh, yay, I got a message like that someone healed or something like that. That's always fantastic. And I like giving people a little bit of their power back too. Like, oh no, like I knew that wasn't right, or I know I can do this, and you kind of train them a little bit to.
For sure. And I also think with the right wound care, you can avoid certain types of scarring potentially as well. Yep. So could you talk a little bit about that side of things?
So no matter what, you're gonna have, after any procedure, you're gonna have a scar of some sort. So one of the big things is definitely using like a scar fade cream and something that has SPF in it, especially if it's somewhere that's going to be exposed early on. For sure, once the wound is closed, you can start doing something like that. But with wounds and scars, the faster we can heal the wound, the better the scar is going to be. So we're trying to heal the wound as fast as possible. And that's not usually using gauze and saline packing. That is super, super old school. It has been debunked as like the thing to do, but you will see it routinely. And it's really just like maybe one of the only things that they learned. It's just cheap, easy, readily available, but wet to dry is painful. It rips out good, healthy tissue. It keeps your wound in a chronic state. It causes scarring. It can make, if you are someone that keloids, it can make you like keloid. That could be part of the problem. So we absolutely can do better than that. And there's like thousands of products on the market. So it's overwhelming if you were just to go online and like try to pick the thing yourself. And that's where
for sure
kind of like needing a hand.
For sure. So can you tell us about maybe a situation where your input has been invaluable to the patient that you've seen in with regards to their wound?
Always is that. No, I'm just kidding.
No, of course it is. Of course.
Of course it is. No, I actually just was working with a woman. It was a virtual consult. She had a tummy tuck. She was out of the country with her military family and really didn't speak the language, didn't know the medical community was not what she was used to. She didn't really know what to do. And the doctor that she was seeing just kept restitching her, which once your stitches open up, you do not want to really let someone restitch you closed. Usually you leave it open and you allow the tissue to grow in on its own. Or now, I don't know if it's common for you, but a lot of times they'll use a wound vac. If it's the right situation, just because it seals everything. So anyway, she was in another country. She had been stitched up 3 times, and it just did not. It wasn't looking good, but I wasn't sure what her situation was about. Like, I was trying to help her, like where she was, and she's like, "Tell me what you would tell your sister," and I'm like, "Well, I don't have one, but I would tell her to come home." So she actually did. She got on a plane, flew home, and got to a wound center. Like, let's say we talked Thursday or Friday. She got an appointment for Monday, got in, and they completely like re-debrided her, opened her up. Like, the incision was massive, the reconstruction that she is going through. And then they put her on a wound vac. And so who knows, like, she might have gone septic. You cannot like diminish the fact that like your body is open to all the bacteria out there, and sepsis is like a real, that can kill you.
Yeah, for sure. And it's one of the things that I know we had a campaign a few years ago in the UK for the signs to look for sepsis, because it's one that gets missed way too much. And if you have any, like you say, any type of wound, it should be on the top of the list of the things for you to be monitoring, really.
Yeah. And I do some work at a hospital, and some guy just came in. Like, if you have implant devices anywhere, like you have any fake parts anywhere, the infection like goes there. I don't know why, but it'll, like, your body will start fighting that device. So he lost his knee implant.
Oh,
And he didn't even know. And they were like, you could have died. Like, that's a direct line to your heart.
yeah.
Your blood, it's just pumping it right to your heart. You could have died. So it's definitely something to be aware of, even years after you forget, like, oh, I have a the piece that's not mine that's in there. An infection can come from anywhere.
For sure, for sure. So, what are the most common misconceptions that you come across when you have your patients in with regards to wounds?
You don't have to let it air out. You don't have to leave it open to air. Actually, wounds will. There are a few situations where you want to let the wound air out, like if it's on a toe on someone who has poor circulation, just leave it be. But if we're talking about a relatively healthy person, it's a surgery situation. You leave the incision open, but wounds will heal better, even like your cuts and scrapes and stuff. Like, you don't need to leave it open to air. The air is not helping. To keep it covered.
Okay, cool. Okay, so what would be, apart from that then, what would be your top tip that you could offer to people about their wounds?
I think besides that, I would say what we were talking about with the scars is that it's something to be aware of, like down the line, when, like, I've had a C-section, but I get back pain, and I know that they're not, like, I had an injury to my back, but when they're connected. So when you're working with someone down the line, like your body practitioner, tell them the procedures that you've had, because show them your scars. There may need to be that might help to address them.
Oh, for sure. I'll tell you a situation with me. I had a lady come in with back pain, just back pain. She hadn't told me she'd had a kidney transplant.
Yeah.
So you go through the whole thing, and it's like, right, like the
What
things
is this?
you're expecting to see, and then all of a sudden it's like, what's this?
Yeah. Wait a minute. Why didn't you tell me yet?
Yeah, that happened a few years ago, and it's like, that's really important to know.
Yeah, absolutely. And we want to know that, like, we're not, it helps us help you. So
sure.
just like telling us what's going on, even if you think you're crazy for thinking things have to do with each other, it's not. It's totally possible that everything is connected, and the wounds want to heal. So if your wound is not healing, if you're not seeing like significant change every week, there's something off. And it may be like products that you're using, it may be cleansers, you may not be feeding your body enough good nutrient, like there is something off. So definitely try to get with a practitioner. You can reach out to me. It's all good, but it might be just a simple little change, but the wounds want to close, and it should be it should. The wound's gonna you expect the wound to get smaller, the drainage to get less, the pain to get less, the sensation to improve. And if something isn't going right, then something's off, and we could usually at least point it in the right direction.
For sure. So last question then, and it's something that I ask to all my guests. What does mindful wellness mean to you?
I think it's kind of cliche, but it's all like that. We're all connected, and you have to take into consider, like, every part is important. Your mental health, your physical health. If you're taking care of yourself and your energy and the people around you, it's all connected, and it can come up in weird ways when one thing is off. And it's okay to stop and reset and change whatever needs to be changed. Taking care of you is like the most important thing.
Awesome. I love that. So thank you very much, Heather. So if anyone would like to find out a little bit more about Heather, how she works, you can go to betterwounds.com, or I believe you're on Instagram at better_wounds. Is that right?
Yep.
Okay. So thank you very much for your time today.
Thank you, Tracy.
Thank you for listening to today's episode of the Simply Mindful Wellness podcast. Join us next time for a new episode.